Hi, I'm going to talk about the types of supraspinatus tendon tear. The supraspinatus muscle is attached to the greater tuberosity of the humerus. We all know that. Do you know that supraspinatus has two layers? One is the bursal surface, because the surface which is very close to the bursa, we have a subaqueal bursa here. So that fibers are called as bursal fibers, and we have the articular fibers here, the one which are very close to the joint itself. So the fibers which are close to the articulation of the shoulder joint, they are all called as articular fibers here. So we have bursal fibers and articular fibers that constitute the supraspinatus tendon. They both are arranged on top of other. If the tendon tear happens in the top, we call that as a bursal type of tear. If the tendon tear happens at the bottom, we call that as a articular type of tendon tear. So usually the bursal type and the articular type, they fall under the category of partial thickness tear. What is partial thickness tear? If this is the full thickness of the tendon, top to bottom, superior to inferior, this is called as full thickness. In that, if half is torn, then it is called as partial thickness. So the partial thickness can happen in the bursal side, or the same partial thickness can happen in the articular side. Based on the locality, the type of the tendon tear is named. Apart from that, we have one more type of tear called as delaminating tear, which is nothing but the articular side of the fibers will delaminate and it will retract somewhat like this. So instead of being like that, it will be like this. So this is called as delaminating type of tear. There is something called supraspinatus tendinosis. Tendinosis means there is no major degeneration of the supraspinatus muscle fibers, but there are some sort of degeneration within the interstitium of the tendons. So it will be somewhat like this. In the MRI, it looks like little water accumulation in the form of bright white appearance in the weighted MRIs. So tendinosis in long run will become a tear. Will begin as a small micro tear, and then it become like a partial thickness tear, something like this. And partial thickness tear at some point will become full thickness tear. The full thickness tear is expressed in terms of the superior to inferior type of thickness. But the tendon is three-dimensional, isn't it? The tendon also has anterior to posterior margin. What you see here is a superior to inferior line, and what you see here is anterior to posterior line. So the tendon can get torn superior to inferior, but it can affect only the anterior fibers here. Okay, or the tendon can have full thickness tear, and it can involve entire fibers of the supraspinatus both from anterior to posterior. So in this case, we call this as a complete tear. What is complete tear? It is torn both in superior to inferior direction as well as from anterior to posterior direction, and that's when the supraspinatus muscle has lost its complete contact from the greater tuberosity of the humerus. So in such cases, what will happen is, as the muscle is attempting to contract, for every contraction, the muscle tend to retract. That's why in long cases of supraspinatus tendinitis, we not only see the tear, but the tendon will get retracted somewhat like this. So more the distance it retracts backwards, the difficulty is for the surgeon to do the surgery, and that's when it tend to do some grafting or something like that. So it can begin as a tendinitis, it can become a partial thickness tear, and then it can become like a full thickness tear, and then it can become a full thickness complete tear, and then it can become full thickness complete tear with retraction. That's when these people will be having the drop off test positive, because they'll not be able to hold the shoulder above 90 degrees. There are so many reasons for this condition. For the young people, it is usually due to repetitive activity, like if they are playing some sports like basketball or volleyball or badminton. So we call that as a repetitive stress injury related supraspinatus tendon injury. Sometimes it can happen to a single abrupt macro trauma. For example, when someone fall from the bike in the road traffic accident, in one shot the tendon can get torn. So that is called as abrupt macro trauma. The earlier one was repetitive micro trauma. So both can cause injury to the supraspinatus. The third category we have, which is common for the old age people, we call that as a degenerative tendon tear. Because of the tendon is very low in terms of metabolism, very low in terms of blood supply, and due to the over usage for so many years, the tendon will get degenerated first. A degenerated tendon, if it is attempting to do some heavy work, for example lifting some unusual weights, then that's when the tendon will snap. A degenerated tendon also can get torn, but usually the age group is old category. What will be the clinical presentation? Usually these people will have a contractile problem. What is contractile problem? Any active range of motion will be affected. For example, when they lift, they try to lift with a shrug sign, and if you hold them on top and then leave abruptly, they will drop their shoulders down, either because of pain or because of inability. In tendinitis, they usually drop because of pain as a reason, whereas in complete tear, they drop as a result of weakness. So remember, when there is a drop arm test positive, it can happen either because of pain in acute tendinitis, or in chronic tendon tears also it can drop. But the first category, the drop arm test is positive because of pain. In the second category, the drop arm test is positive because of muscle tear. As a physio, we tend to diagnose and identify what are the comorbid factors here, what is the type of tendon tear, what's the patient's age, why it is not improving, is it some external impingement happening in the form of spur or in the form of bursitis. So accordingly, we give certain loading strategies, tendon preservation strategies, certain corrective exercises, and some lifestyle modifications and so on, so that we try to restore the movements, we try to reduce the pain without getting the surgery done. But sometimes in extreme cases where physio cannot help, that's when the surgery is needed. But 80 to 90% of the time, surgery can be avoided if these things are followed, like load management, corrective exercises, and restoration of metabolic health, modification of ADLs. With all these things, most of the tendon tears can be helped. But as I said, sometimes some people anyway they need the surgery, so that time get the surgery done and then come back to physio. Then we will rehab so that the patient can get back to their normal life. I hope this is little useful for you. Thank you.